So, Dr. Fankhauser, are you doing orthodontic work in your office?
Yes, we are.
Tell us about it then, because I know there's a whole different, there's a whole variety of orthodontic treatments out there, at least 2 or 3 major ones. I would like if you shed some light on each one of them.
Sure. Well, and the first thing I need to say is that I'm not an orthodontist, but I have had training both in what we call straight wire orthodontic treatment. That's using the little brackets and the wires on the teeth. And I also am a preferred provider for Invisalign. So I do a lot of Invisalign cases. That's with the little clear aligners that fit over the teeth, and you can't hardly see them. So whether I do it one way or the other depends on the patient's age, the situation that we have to treat, whether it can be done easily or it's going to be a little more difficult. But we can do it either way.
Okay. Well, that was the difference between, let's just say, they at least in the old days, they did the braces with the wires, and pretty freaking ugly looking. Then we have I guess, what's called the clear braces, and they're like much less visible. And now you have the Invisalign, which is not even any braces anymore. There's no more wires there. There's just, plastic covers, I guess. Give us a little, breakdown. Number one, when specifically can one not be used or one must be used?
That's going to be a little more difficult. Let's say you have a large discrepancy in how the upper and lower teeth fit together. In other words, the jaws don't match up very well. Okay, then you might be able to straighten with Invisalign you can do some minor treatment that way if it's not too bad, but if it's very much, you're going to have to get into some straight wire, some brackets, and maybe some extra appliances. Sometimes you even have to do surgery to get the teeth to match together.
Okay. So
that's another story.
When a problem is huge, the spaces between the teeth are very huge, and alignment or misalignment is very huge, then the more old-fashioned of braces has to be performed rather than the Invisalign, right?
Yeah, generally speaking, yeah.
Okay. Now tell us about Invisalign a little bit. How did it come about? What is it? How does it function? What are some of the major advantages in terms of comfort and etc.?
All right. One of the big advantages to Invisalign is that during treatment, with people that are wearing the brackets and wires, have a very hard time cleaning their teeth. As we talked earlier about, if it's hard to clean, then they don't do it as well.
Right.
So, the teeth may get cavities. The person could get a little gum infection or something going because they're not cleaning very well. With Invisalign, you just take the aligners off, clean your teeth. There's nothing in there getting in the way, so it's a lot easier to maintain. You take them out when you eat. You don't get all the spinach hanging off of your wires, So and then by and large, you're not popping off brackets or having wires poking you in the cheeks and that sort of thing.
Okay.
So they're more comfortable.
I see. Wonderful. So now they're called Invisalign. Are they really invisible? I mean, if I go for a job interview or have that first date, are they really invisible?
Are they really invisible? Well,
Am I putting you in the spot?
They're, shall we say, nearly invisible.
Okay.
You could wear them on a date, or you could wear them for a job interview. I don't think it would hurt anything. But
you might not think so.
You also
like,
could,
let's just say a very conscious person who goes like, so will it be seen?
So, if you have an issue with that, you can always just take them off for an hour. We give you a little case to put them in. You stick them in a little case, put them in your pocket or purse, and after your interview or your date, you put it back in.
Oh, that's wonderful. Yeah, I mean, obviously, if you can take them off or I suppose supposed to take them off for eating, which is 2-3 times a day anyway, right?
Yes.
Then, as long as you don't make a habit out of it, of having them off half of the time, just for that one interview, an hour or two here, and for that one here and there, you solve the problem till you probably become really used to it and realize that actually they are A, rather invisible, and B, people don't care. They just look at you as like taking care of yourself.
Yes. And some people might be jealous that you have them and they don't. But but as long as you're wearing them, 21, 22, 3 hours a day, you're okay.
Well, wow, well, that's great. I didn't think of that. So basically, even if a self-conscious person and at the beginning while having them is like, oh my God, I think I can see it, people can see it, or maybe my speech is a little still spurred because I'm not totally used to them yet, whatever the person might think is happening, take them out.
Yeah.
Take them out for a very short period of time for that so important meeting or whatever. Well, all right. Wonderful. And does the Invisalign treatment, I know it depends on everything on how bad the teeth are in the first place, but how long does it usually last? A year, 2 years, just like the normal orthodontic treatment? Pretty much.
We see a lot of cases that are done in, 16 months or less. More serious cases go a little longer, up to 2 years. Rarely over that. Okay.
And what about in terms of like how often you have to come to the dentist, to the orthodontist to, adjust your braces or to get new retainers or whatever? Is there a difference? Is that more easy with Invisalign also?
There will be fewer trips to the office with Invisalign. With the brackets and wires, there's a few more things to adjust and corrections to make along the way. So, if there's very little things that can break when you have Invisalign. So, once in a while we run into something. Somebody actually broke an aligner, so then we have to go find a replacement. So.
Okay, but on average it's not. Good to know. Mm-hmm. Good to know. So obviously if a patient kind of says, I would like the Invisalign due to all this conference I heard about, the dentist, the orthodontist will kind of let him know if for some reason his mouth is too much out of alignment and doesn't qualify for it, right?
Right.
Okay.
Yes.
So he doesn't really have to make the choice. It's not like buying a car. Do I want this car or that car, and I'm the one who chooses. It's like the dentist chooses it for you.
Yeah.
He will tell you that it doesn't fit or something like that.
Yes. Yeah. If it could go either way, then, generally I prefer to go with the Invisalign. If it's possible. Yeah.
I'm sure
it's better. Yeah.
Based on what you just told me, number one, it's invisible, less trips to the doctor, no wires poking out, able to be flossing and brushing, no spinach hanging out. I mean, sounds to me like an awful lots of advantages if it applies. Well, all right.
Yeah.
Thanks, Dr. Fankhauser.
Thank you.